how do you find the right physio? Sometimes you just have to ask them, a simple question. Tell me about your training background. If you go to a physio who doesn't really train much, I hardly doubt that they're going to understand how to get you into a gym and get you lifting properly and get you doing all the things you need to do. And when we're talking about an ACL rehab, we're talking around, let's say, 2 hours a day for 5 days a week over 9 months. You're looking at around 360 hours of work. That money better be going to somebody who can get you the right results. Easily, I'd say it's 80-90%. I could be the best physio, the best anything in the world. Now, you might find that kind of physios use, or in general, people use swelling and inflammation interchangeably, right? So it's like, you have swelling and inflammation. But the reality is inflammation and swelling are separate. Whereas the off season is just a nice time for your body to do something different. It doesn't mean you stop training, but if you play soccer, you might want to go play, right? So I'd say the biggest thing athletes do wrong in their off season, everybody has to do, if we could only pick one exercise and that's the exercise you're going to do for the rest of your life.
Yeah.
Probably my go-to.
Welcome to the Awarenezzz Podcast. In today's episode, we had a chance to speak with Kurt Micallef. Kurt is a physiotherapist that has more than 15 years of experience in the field. And in today's episode, he let us know about his philosophy, which is pretty different to the one that you've heard about. We talked about how important it is to actually choose the right professional to work with and how not every athlete should work with every physiotherapist that there is. They have to be selective in this process. We also talked about the mental part of an injury, which is one of the most important ones, and how an athlete can navigate through it and how to turn your mind into your biggest weapon to help you recover better than before. So if you're an athlete that is going through an injury, or just any athlete, because to be completely honest, every athlete is going to go to an injury, you definitely have to look at this podcast. If you want to make the best out of that situation, this episode is definitely for you. Enjoy.
Hey, what's up, guys? Welcome to a new episode of the Awarenezz Podcast. Today, we're here with our guest, Kurt Micallef. Thank you very much for being with us, and introduce yourself to the people.
Hey, thanks for having me. Happy to be here. My name is Kurt Micallef. I've been involved in high-performance sports for the last 15 years. I've been dealing with elite-level athletes, professional athletes, and obviously the recreational athlete for over the last 10 to 15 years with a lot of expertise in strength and conditioning, sports rehabilitation, and high-performance cognitive development.
Perfect, Kurt. Well, now just looking forward to get into it. But I want to start off with some data, that I'm sure you would appreciate, which is nearly 1 in 4 young athletes under the age of 25 who return to high-risk sports after a major knee surgery end up suffering a second ACL surgery. And athletes who rush back to the field just based on a timeline rather than passing objective strength tests are up to 7 times more likely to get hurt again. This is something that has happened to me, and I think it's something very important. And I wanted to ask you, what is the danger, or what should a player focus on when returning to play? Is just feeling good a good indicator, or are there other things that they have to go through to be able to say, okay, I'm ready to play again?
Yeah, I think that's the ultimate question when it comes down to most rehabs, whether it's something like an ACL or lower back pain or whatever it is most of the time it's easy to go off the way we feel of pain, right? And we see this a lot. I've seen it in clinic all the time. Well, I'm feeling good. I can get back to playing, I'll be back next week because I'm feeling good. The pain just kind of decreases and I'm back to playing. But we have to understand that pain is not a good correlation of injury. We tend to correlate pain with injury purely because you get an injury and you feel the pain. And in most cases, if let's say you tore your ACL, you're going to feel that big sharp pain going through your knee, and then it's going to inflame and it's going to get all messy, and you correlate that big pain to injury. But the reality is that the pain does not correlate on how severe the injury is. And in a lot of cases, we see that there's not too much pain, but we still see a lot of lack of mechanical function, meaning that there might be a lack of proprioception. So that might mean that you think you're running fine, but then when we record you, and we record you in a straight line, you can see you have this kind of limp when you're running. You're still not feeling any pain, but we know that functionally you're not ready to go. So this is why in rehabs we have criteria. We try to move away, and many rehabs now are moving away from a timeline-based rehab and more of a criteria-based rehab. Because the way you react to an injury and the way I react to an injury are going to be very different depending on how I perceive that particular injury.
Definitely. And now that we're talking about criteria, which I think is a great approach to it, I just tried, like, I think this is my second knee surgery. And before, one of the things that caused me to get injured again is I was so attached to a timeline, right? So I would try to rush things to adapt my injury recovery to the timeline instead the timeline for the injury recovery. But what are some of those criteria that you look at? Let's just put an example in an ACL injury. What are the main things that you want to look at?
I mean, a big thing we're looking at is confidence, right? So we can look at all the physical components, and obviously there are many components we look at. But one of the biggest things I would see and I would want to see from my athletes is that they are confident to perform. Meaning, by performance, it doesn't mean end stage getting onto the pitch. It means if I want to test them on a vertical jump, I need to see that they are confident to do that, where I give an example, let's say I'm going to test you on your vertical jump. And I can start to see, I'm not quite sure. Let's see how it goes. And I need to persuade you to do it. I know you're not ready. Even though physically you might be ready, I know that you're not ready because you have a lot of doubt. And we know that there's a big correlation between confidence and re-injury. Now, when we look at the old school way of doing rehab, it was very much timeline based. So let's say with an ACL, you'll kind of say, okay, by the 3-month mark, I should be running. But then what happens if we get to the 3-month mark and your knee is still very inflamed, or you don't have full range of motion, or your proprioception is not quite there yet, but now in your brain, it's already been said that 3 months we need to be running. It starts to create even more negative impact rather than positive impact, which is what we need for long-term rehabs to be very successful.
Definitely. And I mean, now you mentioned how you want to get to that point of being able to have the confidence to, let's say, do a vertical jump. How do you build this confidence if you're not able to do the movement? If you're not necessarily able to do the movement, let's say, how do you get somebody to do a vertical jump without doing it because he's not ready for it?
Yeah, I think that comes down to the basic premise of progressive loading, right? So obviously we're not gonna just get you off the massage table and say, okay, go jump, let's see what's gonna happen and hope for the best. Everything comes through progressive loading. So just like when you're fully healthy and you're going into the gym, you don't just go and rack on 200 kilos or 150 kilo squat and you're just there. You build up to it, right? So you have a certain amount of periodized training that builds you up from, let's say, your 80 kilo up to your 100, 115, 120, and so on. It's the same thing for rehab. Essentially, what are we looking at when we're looking at rehab? It is strength and conditioning under an injury. So we're taking the same principles, but now we're breaking them down into smaller chunks. So let's say we're looking at your ACL. We might say, okay, I want to get you jumping, but first we need to teach you how to start bending your knee, right? Mm-hmm. Why is it that as soon as you come out of the operation, walking is so weird? Like it's almost like we have to teach you how to walk. We do have to teach you how to walk again. It's because your brain and your spinal cord and your nervous system is not linking up to your body. So you start to lose your muscular control, your body's awareness in space, your stability. And that always comes down then to how your brain is perceiving the injury to protect it. But now we need to train you out of that. So that would be the big difference when it comes to rehab is the vertical jump or whatever exercise test you want to do. That is an end stage. It's not the goal, right? That's just a criteria test to make sure I can continue moving you forward. But my goal is not to make you vertical jump. That's just part of the process, right? And it's an indicator to move into the next phase, if that makes sense.
Yeah, definitely. The same way that you do things before vertical jump to prepare you to jump, the vertical jump is one of those things that you do to prepare you to play again. So it's just another roadblock that you want to go through, right?
Correct. So it's one of those things where it's one element to show me and to show you or the patient or the athlete that, look, I can do this. Now, we know from criteria based, there are certain deficits we allow and we don't allow. So ideally, we want everything to be under, let's say, a 5% deficit, right? So if, let's say, we compare your left to your right, and we do a vertical jump on your right, and we do a vertical jump on your left, and your injured side has a deficit of more than 10%, you can still jump well, you can still have the mechanics can be fine, the biomechanics can be fine, everything. But there's a deficit. So we know that, okay, you're almost ready to move, but we still need to improve that output, right? We still need to improve that power. So I will still keep you a little back, still layering on small things for the next phase, but I'm going to keep you a little bit back because I know there's still a bit more work to do. Otherwise, if we say, hey, you're not feeling any pain and you look like you're jumping kind of well, let's go to the next phase. Inevitably, later down the line, we're not going to be able to get to where we need to get because we haven't created that solid foundation to move you forward.
Definitely.
So,
and Matt, I'm gonna let you talk, but I just wanted to touch on that because yesterday actually I did my tests to see how symmetric my left leg was with my right leg in terms of like my quad strength, and we still have a long way to go. It's 70% is asymmetry, so there's still a long way to go. But the weird thing is that my hamstring is as strong as the between the right and the left one, but then my quad is way weaker than the other one. That's the problem
How did you test that, if you don't mind me asking?
Yeah, so they have I don't know if it's the best technology ever, but they have like one I don't know, a device that they put on your so they put like a belt around I don't know, a pole or one of the legs of the table, and I sit down and I have to do like a leg extension, but I can only do it until here. And then they put a device behind that belt that measures the amount of force that I'm producing. I think that's the mechanism that it works with.
Yeah, so they're using a handheld dynamometer. So what it is, it just measures force and it can measure in kilos or newtons or whatever it is. Yeah. So like that, again, that's not a bad way to do things, especially depending on the clinic you're at and kind of what the resources are. And obviously every clinic has different finance and budgets and different equipment to use. So let's say, for example, one of the gold standards we use would be something similar, but it'll be called, there's a brand called Biodex, or it's called I forget the actual terminology of it right now, but essentially the biggest brand is called Biodex. It's a nice chair. They strap you in. You look like you're going to take off in a rocket, and then you just kick as hard as you can. Flexion.
I've done that one. Yeah, that one is so hard.
Right? That's giving you constant resistance through all the range of motion. Yeah. Now, that's great in theory. And this is an issue, again, we see. And I've seen this in the past as well, where I have players coming in and saying, hey, I just did my Biodex and I have a 10%. I have less than 10% deficit from my left to my right. I'm good to go. I can play. No pain. The muscular symmetry is kind of there. They hit the Biodex scores where I'm like, okay, great. That's fantastic. But I didn't realize you play your sport sitting down in a chair strapped in, right? So this is a big misconception that a lot of people have when it comes to data collection. Data collection is just a tool. Right, the Biodex and the asymmetries and whatever you're collecting is just a tool to move you on. Because what is the output? I care about your function. I want to see how you're moving. It's great and all that you have less deficits, but if you cannot cut, if you cannot jump, if you cannot decelerate and accelerate, then what's the point of having a good Biodex? Because the reality is that's a good piece of paper saying, hey, well done, you're doing a great job. But you're still not at where you need to be. So then it comes back down to your original question. Is pain a good indicator of whether I should go back to play or not? And the actual answer is it's obviously not, because there's just so much more to it, right?
Definitely. I'd say, my bad for interrupting you.
All good. I wanted to ask about the lack of confidence. You said like it's a high risk of re-injury. And for example, I had like a lot of ankle injuries. So let's say I go back, but I'm not fully confident. The risk would be for me like not pushing through the actual motions, and then there would be a risk of injury. Or how does it work?
So it's multifactorial, right? So we have to kind of see, when we look at confidence, what are we really looking at? Confidence is a bit of an umbrella term for many different factors, right? So we kind of say, like you have to be confident to do it. But you actually have to do to be confident. So it's one of those kind of things where confidence is an end product of doing, It's not, you didn't come out of your operation or your injury and you were suddenly confident. You got confident because you were building up to where you have to be, right? And when we're looking at it from a confidence perspective, what tends to happen is if you go into something that you are not confident in, it means that there's something happening in your brain which is not allowing you to progress. Now, that could mean if you're playing soccer or football or hockey or whatever it might be, that might mean that what's going to happen is when you are trying to do something, either you're going to have fear avoidance, which means that you want to go into something, but then you go in kind of half-heartedly. So you're almost, let's say you're going to go for a tackle. It's like, part of your brain is telling you, I'm going to get that. The other part is telling you, maybe I shouldn't. And now you're stuck in that halfway road, and that's when you get injured again, right? Because the person you're up against is not going to be thinking that way. Or you misstep, meaning you might hold yourself back, which means that you do something in a way which your body is not used to. And instead of hurting your ankle, you might move in a different way and you feel your hamstring or you injure your knee or whatever it might be, purely because you're trying to rush back into the sport without the right mental factors to get you where you need to be in the level of sport that you're playing at.
Definitely, Kurt. And I mean, we're talking a lot about the mental part of things, but I wanna make sure that we cover that very in depth later. And now I want to go back to a point that you mentioned of how the medical part and the strength and conditioning part have to be very related. And I wanted to ask you, how should an athlete approach their strength and conditioning, let's say when they get injured, and then also when they're not injured, to avoid maybe the risk, not avoid, but reduce the risk of injury? Is there anything different from the conventional view that you see a lot of people have that they should perhaps implement to make it more efficient towards their efforts of preventing injury?
So it's one of those things where we know, in fact, there's actually some good research coming out from the British Journal of Sports Medicine. And with a good neuromuscular program, so we're not talking just strength, right? We're not talking about going and lifting weights. We're talking about a neuromuscular program where we are training movement. So we're talking about training a particular movement for your sport. So it's not like going into the gym and doing a hamstring curl. We're talking about saying more compound movements, more, let's say, functional based movements. I know we like to use the term functional, but let's say task specific movements. We can see from research that by having a good neuromuscular program, so preventative program, you can reduce injuries by around 61%. Now in professional sports and in elite sport, 61% is staggering. 2% improvement is amazing in elite sport. 61%, your team managers, your coaches, your whole club, the administration are going to love you because it looks like your players are just constantly available, right? So what does that really mean in practical implication? Because what we tend to find is that research is great, but it's just not practical. We kind of say, if you do this and this, then it's fine. But then when you look at the actual training day, the coach wants all the time. The players, most of the time, are not compliant. And the ones that maybe might do it just to rush it through to say they did something, right? So what does that mean? It means kind of finding your minimal effective dose. That's what we kind of care about. I can write you the best training program in the world, the best rehab program, whatever. But if you're not going to do it, it's just a waste of time. But if I can get you to do one or two things really well, I'm going to get a much bigger effect over time than having that great training program that might be done once in a week, once every month, whatever it is, right? So I'll give an example of what I had done with a club, which I was working with a few years ago, where they were having a high injury rate. So I was with this club for around 3 years, and the first year was kind of just observing, right? Kind of, there's only so much you can do without right data and information. And you see the preseason, you can see what they're doing, the runs they're doing, the intensities, the volumes, kind of everything. So then the next year, we only changed two things. We took out this is for soccer, by the way. We took out all the long distance running. Our preseason, I think, only had the first 2 weeks of preseason had some zone to aerobic capacity just to build a basic foundation. And then we changed all the preseason intensity to small-sided games. So everything had to do with small-sided games, short bursts, anaerobic capacity, recovery, lactate threshold, making sure that the recoveries are shorter than the working rates, to make sure that the players in their training are pretty much doing exactly what they're expected to do in a pitch, right? And we'll just play with the sizes of the pitch. So we'll have small-sided games, medium-sized games, and so on. But then the bigger change we did is all the strength training that they were doing in the beginning of a training session. And most clubs, like, I don't know why, but like to operate by doing the strength work before the training session. And I'm pretty sure that, I don't know if that resonates with any of the clubs you've worked with, but from the clubs I've seen everywhere I've gone, I've always seen that they do the strength work before and then the training session after. Now, from what I just said, if you have a good neuromuscular training program, you can reduce injuries by around 61%. So what's going to happen if I am going to train you guys, but I'm going to do the strength before you do the actual training? What's happening to your muscles? What's happening to your nervous system, right? Your nervous system now is already fatigued before you even started your training session.
Yeah.
So all the good stuff I want in the training session, and the coach at the end of the day gets really angry because what's happening is now the players are not performing the way he wants them to. So he starts shouting more. And then, the coordination might be off, they might be slower, they might not be able to accelerate. And then suddenly towards the end of the training session, that sprint goes, it's always the last 5 minutes of the training session. The player sprints for the ball and up, they pull a hamstring. But I started the training session by doing posterior chain strength. So you see what I mean? So we changed the training to make sure that the strength work is done at the end of the training session for two reasons. One, I want the coach to have full availability of the mental capacity of the players. They have to not be fatigued. They need to understand, because at the end of the day, we have to go play on the weekend and win. That's the reality of it. But two, when I'm doing basic strength work, I don't need my players to focus very much. The reality is, if I'm doing, let's say, a deadlift, or if I'm doing any kind of cross hack or lunge or whatever, it doesn't really take up much mental capacity. Plus, I'm working with them in a fatigued state. So I already have a neuromuscular issue because now they're fatigued, so the central nervous system is going to be fatigued. But now I'm overloading in a controlled way. Not the other way around, where I fatigue them and now they're going to go into soccer and be in an uncontrolled environment, because the reality is, if you're playing a small-sided game, if you're doing any kind of tactical session, it can be planned, but the ball is always going to determine your movement, and that's unpredictable depending on what's happening, right? So we kind of just changed those two things, and we saw a dramatic drop in injuries purely because we loaded players in the right way and gave them the right dose of exercise that they need. So that was in itself an injury prevention program.
Definitely.
Now, what I tend to find is that people think that injury prevention is doing all these fancy exercises on a Bosu ball and with all these bands, and you have a band wrapped around your head and one around your arm, and you're trying to lift a kettlebell at the same time. And that's the conventional look for injury prevention, right? And it looks great on Instagram. Don't get me wrong. I love to see this stuff on Instagram. It's fantastic. I love it. But that is just not the reality of elite sport. We need the minimal effective dose to ensure the player's longevity over the course of 9 months or 10 months, depending on how long the season is, right? And that's where real injury prevention comes in.
Definitely. And I was trying to remember how did I used to train when I was in academy, because I was like, did we used to do the strength training before or after? And now I realized that it was before. And I mean, it makes total sense based on what you're saying. Like, yeah, ideally you want to perform good in the training session and in the strength training session. But at the end of the day, one of them have to give, because fatigue is a real thing and you're going to end up tired for one. So you better want to be a little bit tired for the strength session than for playing football, because at the end of the day, that's what you want to optimize for, right? And Matze, I don't know if you wanted to say something.
I think coach just gave like a perfect breakdown. Like, I think it was amazing, that example. And I was asking myself, why do other teams do the strength training before? Is it just for the activation before the training, or is there any other reason you could name?
I would say it really depends, because activation is different, right? If I want to activate before the training, it's a warm-up. Essentially, I'm going to get you in the warm, I can do my activations, and then just get you into the training like normal. When we're talking about strength, that's where we have a dedicated time slot in the training session where we're going to bring out maybe some equipment, whatever, some weights or whatever it is.
Mm-hmm.
So there has to be a clear definition between those two. I can take you into the warm-up, and I've done it as well in my previous pre-seasons, where in the warm-up we're doing our band exercises, getting the glutes firing, whatever it might be. I have the bands around the ankles whilst passing the ball to each other, moving sideways. Might be doing some balancing games, eyes open, eyes closed, to get the brain going. This is all activation. However you want to do it, there's no real set rule. It's just you have context of what you want to achieve, and you just create things. And that's the beauty, I think, of the role of, let's say, a physio and strength and conditioning, and merging them together, is you can do anything you want as long as it fits into the context of what you're trying to achieve.
Yeah.
But then the strength side, that's a whole different thing. Is my strength to improve power? Is it to improve hypertrophy of the muscle? Is it just to go through motion or movement? That's where the difference comes in. And I think this is where there has to be a clearer definition by the performance coaches and the medical team to make sure that they stack the training session in the right way. And that's where you will start to see that injuries will drop purely because you're loading in the right way. And when we look at the magic formula for injury prevention, the reality is I cannot tell you there's one exercise that's going to say, if you do this, your injuries are going to reduce by 80%. The real magic formula is just load management. It's just looking at your players, and then team sports is a bit harder, but looking at your players, if you have access to the GPS and the player feedback, correlate and manage the loads. If you manage the loads, your players are going to be fine.
Definitely. And Kurt, I wanted to ask, because I thought you run us through how to merge both strength and conditioning and the injury prevention part, which at the end of the day end up being hand in hand, while people normally look at them like two separated things. But I wanted to touch now on that point that you really mentioned that I think is really important on how do you pick the right professional to work with? How do you pick the right physiotherapist for the injury that you have? Why is that important instead of just going to physiotherapists? Shouldn't they be able to treat any injury?
Yeah, this is actually it's a nice topic of mine, because I come from the school of ACLs as well. So I actually used to play soccer when I was younger, and I moved into my field because I ruptured my ACL, and unfortunately didn't have the best physio, let's say. And think about it this way: if you, as an athlete, go to a normal physio who is used to treating the everyday Joe, most likely, I'm going to guess that physio doesn't know anything about progressive loading, or doesn't really step much into the gym. Obviously, there are always exceptions to the rule, but if the physio doesn't do this as their bread and butter, if it's something which they don't do on a daily basis with pretty much every single patient that they have, I highly doubt that when that one athlete comes in, they're going to suddenly magically know how to dose rehab loading efficiently. Right? Because it's natural. If you're used to seeing 10, 15 patients a day who essentially need to go to work, need to go home, maybe like to go for a jog every now and then this one athlete who needs to suddenly get back to elite sport walks in, my guess is that you just don't have that background to be able to know what you're going to dose them with. That being said, then if you want to be a bit more rigorous with your choice, ask them about their background. Most of the time, you're going to go to a physio because they came recommended. And I'll give you a perfect example with some of the clients I've had, where I have clients who come to me and they say, I got my number from a friend of mine, and they told me that you'd be great to help me. I say, okay, what's the problem? And they're like, I have back pain. And then you start asking them or whatever, and essentially their life is just a normal everyday life. But the person who recommended them is a footballer who just had an ACL. So I would personally refer them to somebody else. I don't need to see that patient, because I know that there's somebody who's more competent than I am to see that particular category of patient, let's say. So just because I come from a high-level sports background doesn't mean I need to see everyone, and I have the capability to see everyone as well. So it goes up and it goes down, right? We tend to believe that if he works in elite sport and with elite athletes, he can do everything. But the reality is it goes the other way around, where I cannot see the normal person, because most likely I will overdose them as well. I might give them too much load. And I have done that, where I had somebody come in who's, let's say, a regular client, not an athlete, and the warm-up itself was already too much load for what their capacity could hold. But in my brain, I'm thinking, well, this is just a warm-up. But it's just a warm-up for an athlete, not for an everyday person. So it goes both ways. But to get back to your question of how do you find the right physio, sometimes you just have to ask them, a simple question. Tell me about your training background. If you go to a physio who doesn't really train much, I hardly doubt that they're going to understand how to get you into a gym and get you lifting properly and get you doing all the things you need to do. If you have an athlete, if you have a physio who doesn't really have much of a sports background, they might have the theoretical underpinning knowledge, but theory and practice are very different things, So that simple question goes a long way. At the end of the day, you need to take care of your body. You're going to invest a lot of money in your rehab. And when we're talking about an ACL rehab, we're talking around, let's say, 2 hours a day for 5 days a week over 9 months. You're looking at around 360 hours of work. That money better be going to somebody who can get you the right results in the right way.
Yeah.
These are all the things that come into play. And that's how I would think about if I had to go through my rehab again, knowing what I know now, that would be the first thing. When I step into the physio's office, those would be the first things that go through my mind.
Because of course, it wasn't that bad as ACL injury, but I had like a bad twist my ankle. Was the first time I had it, so I was like, okay, I have to go to the physio. And the only thing they did was electric therapy, is it called?
Yeah.
And I was told like 6 weeks, and after 3 months, my ankle was still hurting. And then I was okay, I have to go somewhere. So I asked around. Basically what you said, I asked my teammates and asked where they went. So I went to their physio, and they fixed it in 4 weeks, and then I was ready to play again.
But more importantly, I think you saw the contrast in the way therapy is done.
Yeah. So there's just an electric therapy. Maybe it was the most convenient for them. So they just put the electric thing on and then they left. And then the other one, they did massages and actual movements.
Correct. And that's exactly, and we might just say like, I just had an ankle injury. But ankle injuries are very debilitating, and probably out of all the injuries, they're the most lingering injury. So we find ankle injuries can stay for months because we have this mentality of, it's just an ankle sprain, But the reality is you get a lot of instability in the ankle. You get chronic inflammation. When you have chronic inflammation, you get joint degradation as well. That being said, if your base of your body is unstable, what do you think is going to happen further up the chain, right? So these are all small things which, again, it's perception, but that's why the right physio will work for you, for your demand. If you're just somebody who twisted their ankle and needs to go to work, probably the electrotherapy physio is fine. But if you have to go back to playing sports, within the first few days, I would expect that, yes, there is a place for electrotherapists. Don't get me wrong. You can do your EMS, magnetic therapy, TCAR therapy, whatever it is. But if they are not getting you moving and not optimizing your load-bearing capacity, you're in the wrong physio.
Yeah, that's exactly what my second physio told me. Because, of course, there's some ratio of electric therapy, but like the moving of the ankle in the first few days is so important, because she told me I built scar tissue because I wasn't moving enough.
Yeah, potentially. And that's kind of the old premise of RICE, right? Rest, ice, compression, elevation. But the reality is when we look at something like using ice for injuries, in most cases, you don't actually have to use ice at all. The body knows what it's doing. The body is smart. Ice can help with pain, but when we're looking at inflammation, we like inflammation. We need inflammation, right? The body needs that inflammation to get all the good nutrients to the area to start the process of healing. Your body is smart. The problem we find is evacuation of the fluid, and that's where the swelling comes in. Now, you might find that kind of physios use, or in general, people use swelling and inflammation interchangeably, right? So it's like, you have swelling, you have inflammation. But the reality is inflammation and swelling are separate. So think of inflammation as the body's response to an injury where it's bringing all the nutrients you need to that injured site to start the healing process. But then swelling is the lack of evacuation of that fluid from the site, right? So we want to circulate the inflammation. We don't want it to stay stagnant. And that's why things like compression therapy help a lot. That's why things like movement help a lot, because if we look at how do we remove fluid, we need to go to the lymphatic system. The lymphatic system is this nice network of lymph nodes and lymph lines that run through the body, and it only activates through movement. So if you're resting and you're icing, now you're not moving and you're slowing down blood supply. But if you're moving optimally and you're compressing, now you've opened your lymphatic system and you're assisting the fluid to move. And this is what's going to start speeding up that process. And we know that from research, and this is just not on my brain, we know that, let's say with an ankle sprain, something as simple as not icing and optimizing movement can reduce your injury time out by around 2 or 3 weeks. And that's significant when we're looking at athletes returning to play, right?
And then
Yeah,
that's very
so it's
interesting.
actually, you go, Matze.
I just wanted to ask, like, for a regular athlete, how does it know if it's a swelling or an inflammation?
So inflammation is the acute phase, right? You twisted your ankle, it turns into a ball. That's your inflammation, right? The swelling is when it just remains a ball and the fluid doesn't go anywhere. That's your swelling. So let's say if we look at the injury phase, your first 3 to 5 days is your acute phase where you have a lot of inflammation. After that, things should start moving around a bit, right? If after 5 days to a week, you're seeing that your ankle is still remaining the same, the fluid is still there, the ankle is big, that's your swelling. And we need to remove that. And that's where probably you'll find that sports physios tend to be a bit more aggressive when they start seeing chronic injuries with inflammation.
I see. No, I think that's perfect, Kurt, and something that I definitely didn't know about. Like, I wasn't able to like differentiate those two things. And as you mentioned, I used it interchange as the same thing. So it gives me a lot of perspective now that you're saying that they're two different things. And going back to the point on picking the right professional, you mentioned the difference between people that treat conventional people, right? Just want to do exercise sometimes, and then the other ones that treat elite athletes that really need to get back to elite sports. Should we also focus, like as an athlete, on the specific injury that we have, or just the fact that they're experienced training or returning and recovering other athletes is enough?
Ask that question again for me.
Yeah, so when we're picking the professional to work with, do we also think about as a piece of criteria, think about the injury, the specific injury that we have, or do we just look at whether they treat athletes or normal people?
I think it's a bit of both, right?
Okay.
So if I had to, if we're going to generalize, I would always pick, if I'm an athlete, I'd always pick the person who treats athletes, even if they have no experience on the joints that I injured. But that's my only option. I'm going to go to that guy because most likely they just know better. But yes, definitely, if I had to then choose between a physio who treats athletes and is a specialist in, let's say, knees, or a physio who treats athletes, I'm going to go to the physio who treats athletes and specialist in knees. Very same. It's the same context if you're looking at the doctor, right? Definitely. Why would you go to an orthopedics versus a neurologist? The definition is there. You know why you're going. If you go to the orthopedics, would you want to go to a hand specialist or a knee specialist for a knee operation? You're always breaking. It's the same thing. The only difficulty we have in, let's say, the physiotherapy world is that there haven't been those classifications of profession. So physiotherapy or physical therapy or whatever is like one big umbrella term, right? Mm-hmm. Go to the physio. Okay, which physio? That's where now I think the profession needs to take a step forward and start segregating and saying, okay, you're a specialist in pediatrics. You're a specialist in geriatrics. These are musculoskeletal specialists. These are sports specialists. Because then, as a consumer, you now know to differentiate. The biggest issue is that the profession just does not really differentiate at the moment, which makes it harder for you guys to know who to go to. And unfortunately, sometimes you knock on a few wrong doors before you find the right one. And then when you find the right one, you just hug that person and you never let them go, kind of thing. So it's just the way it is. And I think it's a lack of, let's say, progress from the profession itself as well, which needs to change hopefully in the near future.
I see. Perfect. So having that so like treating as a hierarchy, of course, if the person is a specialist in the specific area that you got injured, the better. Then if not, just looking at the fact that they work with athletes instead of like working with normal people. Okay, understand. And Kurt, now going a little bit, because I think you gave us a very good perspective on what to look for in a professional. But now I want to go a little bit to the mental part. And this was probably one of the things that I struggled with the most. And it actually can make the difference, from my point of view, between how well you recover and how bad you recover, and making the injury something good versus turning it into something that can destroy a career. So, it just comes from the fact that you're used to training every day, playing every weekend, and all of a sudden this is taken away from you, right? So how do you deal with that mental part of an athlete when they get injured?
Yeah, from my perspective and my experience, the mental part is the most important thing by far. The physical side is actually relatively simple. It's just progressive loading, and you're just layering on training as you go along. But when we look at injuries, we have two sides to the injury. You have the tissue side of it, which is the damaged tissue or the ligaments, whatever you want to call it. But then there's the neurophysiological side. Now, when we look at the neurophysiological side, we're looking at the brain and the nervous system, So what tends to happen when we look at somebody who has an injury is straight away, their whole demeanor changes. So let's say you're recovering from your ACL. As soon as you injured your ACL, and it's your second time, you probably said something to yourself like, oh shit, here we go again, right? Straight away, you have put yourself in such a negative capacity that we need to get you out of that to get more positivity in. Why? Because we know that if the brain is in a positive state, most likely we're going to have better outcomes. So what does that mean? Essentially, it just means that from day one, if you walked into my clinic, I'm looking at the way you're moving. So I'm thinking, okay, what's the posture like? What's the body language like? Like, are you coming in and are you kind of slumped and, I hurt my knee and whatever? Or it's like, look, I hurt my knee, but I want to see what I can do. The tone of voice, is your body language open? Is it closed? All this is psychological. It has nothing to do with the injury. It has to do with how your brain is perceiving your situation in that moment in time. And that's going to tell me a lot about how I'm going to be interacting with you. If you came in to my clinic before I even assessed you or anything, and I see your clothes, straight away I know that, okay, this person needs more positive input. This person is not in a good state right now, right? So a lot of the way I choose my wording is going to be very heavily revolved around positive wording. If I have somebody who's coming in confident, like, I injured my ACL, but I'm good to get going. I'm ready to go. Let's see what we can do. Straight away, I'm going to become more challenging because I know that this person's in a mental state of they want to be pushed. So now I start to say, okay, let's see what you can do. Do you think you can do that? I don't think you can do that. Show me that you can. You know what I mean? So straight away, I'm taking that person forward. So those small things already are going to differentiate on which direction the rehab goes to get them to the stages that they need to get. So that's a big element of the psychological side, and that's before you've even touched the patient.
Definitely. So like that immediate approach that the athlete has to that injury, switching it from, oh man, here we are, like I'm so unfortunate, to, okay, what can we do about it? And having a forward-looking type of approach, kind of like switching that in the athlete. And I wanted to ask you also, Kurt, because a lot of the questions that one of the questions that a lot of athletes may have may be, am I going to be able to play at the same level again? And also you get a lot of people telling you, oh, after a knee surgery is never the same, like things change, try to not get a surgery or whatever. Like, based on your experience, is it possible to go back to the same level or even better after a knee surgery or after a major surgery?
Yeah. No, normally when I have that question, my first reply is going to be, do you think you can get back? Because that's the most important thing. What I think, to a certain extent, doesn't matter. It's what do you think? I could think you could get back, but if you don't believe you're going to get back, you're probably right. You're probably not going to be getting back to the level you want. So my question is always back. Okay, do you want to get back? Do you think you can get back? If yes, then let's work, let's do it, and we're going to get there. If you have that doubt, I'm going to make sure by the end of the first or second week, that doubt is out of your head. Because I need you to believe that you are capable of not only getting back, but getting back better. Because again, we're talking about returning an elite player to an elite sport, meaning that they are going to be judged heavily when they're back in competition mode. If you're going out and you are at this level, playing in front of 60,000 support fans every single weekend or whatever, and then you come back and you still would be one of the best players in the team, but you're not at that level, you're judged from the outside, you're judged based on how you were. So I need to make sure that when I return you are not here, you're on top of that. Because most likely you are going to be judged heavily, because what's the first thing people are going to say? Let's see if they're back to where they were. So we need to make sure that the people on the outside, we're giving them the answer, but even for the athlete, they're like, nobody can touch me, I'm untouchable. And that's the mentality we build. So throughout the long-term rehab, it's not just about building the tissue capacity, the muscular strength, the neurological feedback. It's also about building that resilient brain, that brain of when things are going wrong, I can rely on myself because I'm going to make sure I get back to where I need to be. I'm better than everybody else. And that is something you train. It's not something you're born with. It's something which is drilled into you in many different ways. But that's what we end up doing. And that's where the rehab comes in. That's the true training. It's not just the physical, it's getting that mentality back.
Perfect. And now we're talking about pushing somebody, but what about those cases in which you have to pull somebody back, that they're just trying to do everything and they feel invincible?
Yeah, those are the fun ones. Those are the ones which, unfortunately, you have to turn off the gym, lock the door, kick them out, and then make sure that you don't see them trying to climb in through the window. Like, we have those. I mean, athletes want to train, right? Athletes want to continue going. But that's where, again, low volume and load capacity come in. So if they want to train, fantastic. You can train. Again, your injury is not defining you. Just because you injured your knee doesn't mean the rest of your body doesn't need work. Right? Just because you injured your shoulder doesn't mean your lower body doesn't need work. So yeah, you want to work, I'm going to make you work, but we're going to do it smart. Like, I don't need to focus 100% of the time on your knee, because as an athlete, there are so many more things that we need to work on. So I have the golden opportunity of as much time as I want with you. Mm-hmm. You know, I don't need to worry about you going to training. I don't need to worry about what the coach wants. I don't need to worry about anything. I don't even need to worry about the wife, because the wives want them to get better. So yeah. I have the luxury of time to work on everything I need. So I'm going to make sure I use full use of that time to make sure this person gets back, not only from the injury, but their body is optimized to where it has to be.
Definitely, Kurt. I think that's great. And we're talking about somebody that just got into an injury, right? And how to reframe that idea of, oh man, this happening again, or I'm so unlucky, to, okay, what can we do to get better as strong as possible? But I mean, you've gave a lot of good advice, a lot of good information, but if you could leave like one technique, one strategy, or one advice to somebody that just got into an injury, and they are feeling down, they're feeling perhaps the doubts that you're talking about, what would that be to kind of like reframe that situation?
Yeah, I think that, it's always going to be a tough one, right? Because everyone reacts differently. Everyone has a different mentality. But for those kind of people, a very important thing is to first accept it. The reality is it's happened. You're injured. It is what it is. But you are not the injury. So not identifying with the injury is very important, And so you say, I'm injured. No. You are still a footballer. You're still a soccer player. You're still a hockey athlete. But you're currently going through an injury. And it might sound similar, but it's very different. So don't identify with your injury. Still identify with being an athlete, but accept that you have an injury to get through, which changes the whole perception of, rather than being injured, you're going through a small challenge at this moment in time. And that's what we're doing. So we need to be aware that this is a phase, right? This is a moment in time that doesn't define your career and doesn't define your future. So your mentality has to be, this is where I want to be. I'm injured now, but I'm going to be there. And whenever you're feeling down, you have to be like, I'm going to get there, because that's your reminder that this is not where I need to be right now. I need to be where I can visualize myself in the future.
Oh man, you talked to me right there. No, Kurt, I think it's great what you've been talking about, and a lot of things, because I mean, we've talked to some physiotherapists, but I think this conversation came from a different approach, and we talked about different things that perhaps a lot of people are not aware of, or they don't really consider that much. Definitely not me. So I think it's great to just get this other perspective to the injury recovery process, the physiotherapy process, because I think it's often overlooked. And I think a lot of people will benefit if they just pay more attention to it and watch a conversation like this one. So before we go to the rapid fire questions, Matze, do you have anything?
No, it's just like Emily said, it was very interesting, the approach you have. Because like you always hear like, oh, you should be positive in the rehab, you're going to get through it. But now we actually know why you have to be positive. Yeah. Also, like the recovery gets faster. And I think it was just a small side note, but like knowing the difference between swelling and inflammation is, I didn't know that before. So it's very interesting. Definitely.
And also the point
Sorry, Matt, you touched on a good thing. And I keep saying you have to be positive. But the reality is, what does that mean? I'm in a shit place right now, and you're telling me to be positive. We need to do better. The reality is, we need to give you the tools to be positive, because positive, again, is like confidence. It's an end result of certain criteria that you're hitting, and then you're positive. And I can't just say, be positive, and you're going to be like, oh, thank you very much. I was forgetting to be positive. Now I'm positive. It just doesn't work that way.
Yeah, in last podcast that we had, was with a psychologist, and he talked about switching positive to proactive, because actually being active, doing some sort of action, is what's gonna lead us to be a positive, right?
Exactly. I mean, how many times have you started training, or we're walking to the training ground and you're like, oh man, I don't feel like training today, but you force yourself to have that action, and then after the training session you're like, man, I'm glad I trained today.
Yeah,
It's just the way we are, inherently we are negative people or negative humans, so we need to be proactive and just force ourselves and fight our brains to get to that point, and then everything will be fine.
I actually had the thought process the other day because we had the training session and like everyone was low energy, and like if I expect, of course, sometimes I have days where like I don't feel high energy, but like when I go on the pitch, I have to wrap it up because I'm going to be even more annoyed after I have a bad session. So I was like, what I do is I go also in the gym, I just start on like the activation part, just doing something like, I don't know, warm up and then do like a high sprint so I can actually feel ready for the whole practice. But then also I wanted to ask, of course, like you have to be positive, but what is something, is that like indicator you like in the right state of mind for the athlete for the injury rehab?
How do you mean? Say that, rephrase
So
that
is there
for
like
me.
some indicators, like, I don't know, maybe there's someone who's positive but he's still relaxed, or like someone who is positive and he's too hyped, or like what is the, wait, I have to control my question now, but like we also talk about
perfect state of mind to be
like
in.
you also talk about like stress hormone like cortisol. When you get like negative, is there maybe more release of cortisol, which is bad for your rehab?
Yeah, I mean, when we're looking at things like cortisol, I mean, if I understand you correctly, you're kind of trying to say what's the optimized mentality to be at, right?
Yeah.
And I think there isn't really a right or wrong answer. The optimized mentality is whatever mentality you come in with, which is going to allow you to work at your maximum capacity for that session. Now, if listening to some sad music and whatever gets you there, all well and good, If you need a bit of hype, if you need a motivational pep talk, if you need some nice motivational video before to get you in that frame of mind, then that's all well and good. The most important thing is that whatever session you're going into, for whatever that session is, if you're working at 60% max, 100% max, 80% max, you are getting a mentality into achieving that. Now, how you do it, there's no right or wrong, but what you don't want to do is go into the session, half-ass a session, and then be sad when you're leaving the session because you didn't do a good session. And that, I see it a lot with athletes where, when I start training, I'll be better. And then they just never get that because, again, it's a mentality. Some do, some don't, but I wouldn't say that's the right mentality. It's what is the right mentality for you, for your training. And that's it.
Definitely. Perfect, Kurt. So if you're okay with that, we can go to the rapid fire questions.
Yeah, let's see what you got.
Perfect. So this one comes directly from me. I'm somebody that, like, one of my sins is thinking that I know more than the physiotherapist sometimes, and perhaps not trusting what they're like, thinking that what I'm doing is not working, right? So what percentage of actually recovering is believing and trusting that the treatment that you're doing works?
To be honest with you, I'd say that's probably a big part of the whole success. I'd say easily, if I had to give you a percentage, I'd say it's 80-90%. I could be the best physio, the best anything in the world. If you don't trust me, you're going to be second guessing me all the time. And we know that whether it's a medical relationship, a friendship, a romantic relationship, trust is a foundational element of any kind of interaction. So if you trust me, I could probably, if you gave me your 100% trust as a physio, I could probably rub your hand and your head. I could rub your hand and your head, and you're going to think, oh man, this physio is amazing. Whereas if you don't trust the other one who's giving you the perfect evidence-based program, you're going to be like, I'm not too sure, So you're always going to be doubting and always second guessing what you're doing, even if it's 100% right. So I'd say that's probably building a good repertoire and having good trust with the practitioner and vice versa is the key element to a successful rehab.
Perfect. Great question. Great answer.
And Kurt, what is the biggest lie told to young athletes about returning to play?
The biggest lie. Oof, that's a loaded question right there. I don't know if I can say the biggest lie.
One of them.
It's because it's a very difficult way to phrase it, I guess, because is there a biggest lie, or is it lack of information? Is it lack of knowledge on the part of the person they're working with? Is it best practice at that moment in time? So it's a big question, but it can be broken down into many different parts, because I could be acting on my best interest and my best knowledge to you, but then you go somewhere else and they'll be like, they didn't do this for you, or they didn't do this. So I wasn't lying to you, but I just didn't know, right? So as much as I understand where you're coming from the question, it's a very difficult question to answer, because there are so many factors that come into the biggest lie that it's hard for me to answer.
Or perhaps misconception.
Misconception.
What could be one misconception? Not necessarily lie, but misconception.
A misconception for youth? Probably a misconception for youth, I would say a lot of the time, is that you're young, you'll bounce back. The reality is, yes, you will bounce back, but you need to put in the work, because what you're not putting in the work now is going to show up later on down the line. Yeah. And I think that's probably the one thing I hear the most from youth injuries. So when I say youth injuries, we're talking about 17, 18, this kind of age, maybe 19, even a bit younger. They will recover faster, but they need to equally put in the work as much as anybody who's older.
Definitely.
Also, what Camilo mentioned earlier, or like what you also talked about, is like that if it says 6 months, it doesn't necessarily be 6 months. Like, there are going to be changes, and you're going to adapt the timeline.
Yeah, I mean, if the timelines actually don't really mean much, because if I were to go with a timeline-based rehab or timeline-based anything, if you take someone like me who has quite a high training experience, my timeline is going to be very different to somebody who has a lesser training experience. Definitely. Vice versa. So timelines are irrelevant, hence why criteria base is so important. We see it all the time with lower back pain. Perfectly fine, but for some reason they keep on returning because they're in pain. But what we know is that they have fear avoidance. We know that they are scared. We know that they have not trained their mind to understand the capacity of their body. So they are seeing themselves in how they were, not how they are.
Definitely.
This is the big key to long-term rehabs or long-term injury return to plays, is that building up that mental capacity to understand the physical capacity.
Definitely, Kurt. And I mean, I know this is also a nuanced question, but what is more dangerous, training too much or training too little? Of course, it depends on the situation, but if you could put it like in a general terms.
If you're an athlete, I would probably say overtraining is more dangerous than undertraining. Why? Because if you're overtraining, it means that your body is just not recovering. So there's no way I can get you to a game and you're going to optimize your performance. Whereas if you're undertraining, and you're most likely also going to you're more likely to get injured. If you're undertraining, most likely you won't be able to play at your optimized level, but you can play to a capacity at which you can compete. And you have a lesser injury risk.
Definitely. Makes a lot of sense.
So it's either getting injured or doing no process.
Either getting injured or having a less of a risk of getting injured. You still might get injured, because the reality is, if you're fatigued and you're trying to sprint after a ball, that hamstring probably is going to blow out. But there's probably less of a chance, because when you're fatigued, you're more likely unable to reach that capacity. Whereas when you're overtrained, you can reach that capacity, but you don't know where the fatigue or the limit is.
Perfect.
Okay. What is one thing athletes are doing in the off season that is hurting their process?
Probably, from my experience, I would say that in the off season, they don't treat it like an off season, and they just continue. Sorry, they treat it too much like an off season, and they kind of do nothing. We need the off season to rest and recover. But the athletes who go from in-season to zero off-season back to pre-season, we see struggle heavily, because there's just so much load in a one period of time. Whereas the off-season is just a nice time for your body to do something different. It doesn't mean you stop training. But if you play soccer, you might want to go play tennis, for example, or you might want to just change your sport to give your body a bit of a different stimulus, even to refresh the mind and give it something different to kind of understand, right? If your sport is ice hockey, you might want to maybe do something which is more of a land-based sport, just to give your body a different stimulation, right? So I'd say the biggest thing athletes do wrong in their off season is that they rest fully and don't give the body a different stimulation.
Definitely. And Kurt, I see you wearing a Whoop band, right?
Yep.
So, yeah. So I wanted to ask you if true or false is 90% of recovery tech just marketing for people who don't want to sleep 8 hours?
There's a lot of question marks on how recovery is measured now. Whether it's a lot of marketing and gimmicks, you can go either way on the science. I've had my recovery on my whoops, I'm at like 98%, and I woke up feeling the most tired I've ever felt in my life, and vice versa. So how much of technology actually works to understand recovery? Unfortunately, I can't really give you that answer. But this is the age-old question of sports science, right? Is sports science improving performance, or is it limiting? Because if I'm giving you a threshold, you're going to stop there. But if there's no sports science, to a certain extent, obviously, take it anecdotally, you'll continue pushing. So there's always this kind of thing of, do we hinder or do we improve performance through sports science? And this is your question, which I don't know. That's the real answer. I don't know.
It's a question of a century.
Yeah, and I think it will continue to be that question till people again to measure emotional output and emotional fatigue.
Yeah.
Love it. Then from a health standpoint, what is one exercise that everybody should be doing?
One exercise that I would say, if we could only pick one exercise and that's the exercise you're going to do for the rest of your life.
Yeah.
Probably my go-to would be something like an overhead squat. That's where I would go to.
Okay.
Right? Because you have the perfect component of strength, full body strength, compound movements, plus mobility. If anybody's tried to do an overhead squat with a stiff thoracic spine, they're not getting very far. They might have a great squat, but the spine is going to stop them from doing anything. If somebody's trying to do an overhead squat with some weak shoulders, that barbell is not going to be doing much, right? So it really does give you the best. It is really the best movement for both strength and mobility, and it's actually very humbling if you don't really do many overhead squats. It's very humbling to do.
Even without weight, it's hard for me. So I can imagine with the barbell.
If you have this, you can have the strongest people who can push press or strict press 80, 90 kilos, but then you get them to go into an overhead squat and they're just so stiff that they can't move. So now your strength has become completely irrelevant. So it's one of those balance exercises where you have to have both.
Definitely. And Kurt, you gave a very good piece of advice and a good technique before when we were talking about how to reframe that injury when it happens. But if you could give just a general piece of advice to all young athletes, which one would it be?
A general piece of advice, I would say, from my experience and the athletes I've worked with in the elite setting, just be delusional about where you want to be in life. If you are a youth athlete and you want to be a professional, be delusional about it and don't listen to anybody else. The best, and when I mean the best, the top athletes in the world didn't get to where they are because they were listening to other people. They got to where they are because they believed heavily in themselves and what they can achieve.
Definitely. But delusion is delusion until you make it a reality, right?
Correct.
Perfect. I love that one. And Kurt, I really enjoyed the conversation, and I just wanted to say that I really appreciate you just being willing to share all your knowledge, all your experience. And I have to say, out of like the people that I've heard talking about these topics, yours is probably one of the approaches that I like the most. So that's probably one of the reasons for which I enjoy the conversation so much. So again, I really appreciate you just being willing to come and speak to us and speak to the people watching the podcast, man. It's been a pleasure.
Yeah, thanks. Happy to be here. Yeah, thanks, guys. I appreciate the conversation. I'm pretty sure we could have continued speaking for the next few hours. So thanks for having me.